Last week, we answered a very simple question, a question that many in higher income countries may not know the answer to. And that question was, what is obstetric fistula? The answer to that question is the basis and foundation for what today's episode is all about. So if you haven't listened, make sure to go back a week and listen to that short episode. Today, I get to dig a little bit deeper into all things fistula with Jessie Chu. We'll talk about how Jessie discovered the devastating world of fistula, how the Fistula Foundation works with communities in need to build trust, how they direct women to the proper point of care, and how they've built a growing network of dedicated surgeons to serve these women. It's called the Fistula Foundation Treatment Network. But before we dive in, here's a little bit about Jessie. Jessie joined Fistula Foundation in 2019 and serves as the Senior Program Manager, helping to support dozens of partnerships in over 20 countries. She learned about fistula while serving as a community health organizer with the Peace Corps in Ethiopia, where she developed and implemented programs to empower youth with reproductive health education. She holds a BA in International Studies from American University and an MBA from the Yale School of Management. Here's a question to think about while you listen. Can you guess what the cost of one fistula surgery is? Listen until the end to find out. My name is Hetal Daman, and this is the Global Health Pursuit. Jessie, thank you so much for coming onto the podcast. This is something that I've been wanting to talk about and feature for a while. So, I've been hearing just on LinkedIn, I like to lurk on LinkedIn a lot. Fistula Foundation has been growing immensely in the last year or so, right?
Yes.
So we are definitely going to get into that. But first, I really want to talk about you, feature you, and kind of get your story. How did you get involved with Fistula Foundation? Where did you get your start?
Absolutely. Well, thank you so much for having me on your podcast, first of all. I'm really excited to get to talk about fistula and the work of Fistula Foundation. Yeah, I was trying to think back to how this all started, and I think it has its roots in a public health class that I took in undergrad. I was an international studies major at American University and signed up for a health communication class, and that was the first time I had ever really learned about public health. The class was all about how do you use communication to influence behavior change, positive public health outcomes. For example, like anti-smoking campaigns or vaccination campaigns and things like that. I was just completely hooked by the opportunity to do so much good through public health. And so I decided to kind of jump all in. And the semester after that, I signed up to study abroad in Thailand, which was a specific public health course where I got to learn about the entire Thai public health system, but also learn and practice different research methodologies like focus groups and surveys and mapping to study public health. So it was really hands-on and really fascinating and just a very special experience for me to get to learn in that way.
I wish I took a public health course in undergrad. I had no clue what public health was. I didn't even know that it was a thing back in undergrad because I was just going to go and be a doctor like everybody else in my family. So, I studied engineering, so it was all straight engineering classes. And I don't think public health really came about until I went on my first service trip to India. Mm-hmm. And it's so crazy how we just don't know so much when we're 18 years old, and then you just come across decisions. Right, and you come across this class, and that's what sparks your interest, and that's just so fascinating to me.
Yeah.
And then you went to Thailand. How was that? Did you ever travel abroad before that?
Yeah, I had really interested in Latin America. I had studied Spanish all through high school and up until that point in college. So I had actually already done a semester abroad in Chile, which was focused on Latin American politics. I did have some comfort with, travel and living and studying abroad. The Thai program was completely different from what I had done in Chile. So it was really fascinating and really special to have that hands-on opportunity. I think much like you, I found public health. This was my junior year that I had taken that health communication class. So it was a little bit too late to make that my major, but
Right.
being able to study abroad my senior year was a way to really immerse myself in that without making it the focus of my degree. So then after I graduated, I had applied to volunteer with the Peace Corps, and I matched with a public health or a health position because of the experience that I had in Thailand. So I ended up becoming a community health educator in Ethiopia for 2 years. And
Wow.
so that was what really influenced kind of the trajectory of my life. Working in Ethiopia, I was based at a very small health center in a small community of about 2,000 people. But there was a high school there and just really incredible teachers based at that high school who I deeply enjoyed working with. And they were really engaged and wanted to be doing more with their students. And so with them, I ended up working a lot on kind of teaching about puberty and reproductive health and goal setting and young youth empowerment at that high school. So that was sort of the focus of what I was doing in Ethiopia. But while I was there, all the volunteers that were in Ethiopia would pass around flash drives with media about Ethiopia because we were also eager to learn more about the country where we were working. And one of the movies that was being passed around was called A Walk to Beautiful, which is a documentary about 5 fistula patients. And it follows them on their journey to the Hamlin Fistula Hospital in Addis Ababa. And so when I watched that documentary, that was where I first really learned about what fistula was. I never encountered any fistula patients while I was living in Ethiopia. But because of that film, I decided to go visit the Hamlin Fistula Hospital, and I was incredibly impressed by the work that they're doing, their facilities, their commitment to serving these women. And so that was sort of always in the back of my mind. And that was how I first was introduced to this topic. But then I decided when I came back to the US to pursue an MBA because the experience in Ethiopia made me realize how valuable it was to have project management and organization management skills. And so I ended up getting my MBA from the Yale School of Management, which is a really socially minded business school. And I knew that I wanted to work in some kind of socially driven field. I wasn't specifically looking for nonprofit, but that was definitely high on the list. I was also open to government or some kind of other social enterprise. And when I was job hunting after school, I found an opening at Fistula Foundation, and it just felt like kind of the threads
It
of my
was just
life were
right.
weaving together. Yeah, that it connected back to this previous experience.
Wow. Everything kind of just came full circle.
Yeah, completely.
That is so, like, how was living in Ethiopia? How long were you there for?
I was there for 2 years. Yeah, it was definitely challenging, but also really rewarding and special. I'm naturally a pretty introverted person, so a lot of why I wanted to do Peace Corps was to really push myself out of my comfort zone and yeah, just see what I could do in an environment that was
Yeah.
really new for me. I took intensive language classes. Part of Peace Corps, the first 3 months of the service are training. And so I had intensive language classes during that training period because when I got to my community, generally the only people who could speak English were people who were working in the health center or in the high school. And so everyone else, in like all of my neighbors, only spoke the local language, which in my area was Oramifa. So it was definitely
Wow.
a challenge, having to communicate in a language that I had only studied for 3 months to build friendships, to build trust, and especially trust around communicating about kind of sensitive topics like puberty and
Right.
reproductive health. But yeah, it was really rewarding. Especially the teachers at high school were absolutely incredible, so motivated to care for their students, so open to new ideas. it was, yeah, really, really special. And the community, I think it was a small community, which was helpful too, because it allowed me to get to know people more
Right.
easily rather than just sort of being an anonymous stranger
Yeah,
in
yeah,
that
yeah. Like
community.
an acquaintance that you see every now and
Yes,
then. Yeah.
yeah. And so I think people really took care of me and kind of helped me figure out, how to buy my food, how to get
Oh
my
my
home set
gosh,
up,
the simple things.
all those simple things, like how to, yeah, take the bus, like all those things that it's all very challenging when language is so limited. So
What was the language again?
it's called Oramifa. So I lived in the region of Oromia in Ethiopia. So it's a fascinating country. I think there's more than 80 different ethnicities and languages
Wow.
in one country, but that was the region that I lived in.
My gosh, that's
Yeah.
amazing. Okay, so now pivoting to Fistula Foundation.
Yes.
Now, the website says that it's the global leader in fistula treatment, providing more surgeries to more women than any other organization, including the US government and the UN. That's pretty huge.
Yeah.
That's crazy. Yeah. Wow. So now the question I wanted to ask you was, when you go into a community and you notice, okay, you identify these women who have fistula. First of all, like, how are you able to identify these women first, and then bring them to the point to where they have the trust in getting surgery to repair this, and like actually saying, oh, okay, I'm not cursed. This is something that can be repaired, and all I have to do is just this one surgery. What does that process look like?
Yeah, that's a really great question. So I'll give some background context first, which is that at Fistula Foundation, we primarily work through local partnerships. So our primary mission is to fund obstetric fistula surgery. So many women who experience fistula are unable to pay for their own care, and so we fund that for them and kind of make sure that all of their needs are met in the facility, that they have, all the costs of the medicine, the, consumable supplies that were required for the surgery, the anesthesia, the surgeon and health provider team's time, the bed, the food, anything that she needs during her time in the facility, we cover. But of course, to get her to that treatment, there are all kinds of other components that are required in the whole continuum of care. And so, as you noted, one of the main ones would be community outreach to spread awareness about not only what fistula is, but also that free treatment is available and where it is available. Women can get to the right facility to get that care. And then we also will support some other pieces like training for surgeons and nurses and anesthetists and other health providers who are caring for women, making sure that the equipment in the facility is up to date to provide that quality care. Some circumstances even supporting reintegration where there's opportunities to do so. Touching back to that community outreach piece, we primarily work through local organizations. So they will often, I would say, I think in most patients are identified and referred through community health workers. So these are generally people from the community who speak the language, who are known. And so I think that really helps with building the trust factor too, which is in many cases, we also work with fistula survivors who become ambassadors for their community. So they will then, I think they're the strongest reference we could possibly have to say that they experienced what these other women are experiencing, and then they were able to get free repair. We have a lot of people too who say, is it really free? Like they're kind of mistrusting.
Are you guys going to take my organs? Like, oh.
Yeah. I mean, there's all kinds of misconceptions like that. And so, yeah, they're just a really strong reference for us to be able to find other women who are suffering and make them feel supported. And we have some in Kenya, especially. So we kind of work through two strategies at Fistula Foundation. The first is that we support individual hospitals and surgical teams that we did and that we believe in and that are doing good work. But they kind of work often just sort of on their own, and they're accomplishing incredible things, but again, sort of on their own. And then our other strategy is that in 2014, we launched our first treatment network in Kenya. And we've since replicated that in Zambia in 2017, in Democratic Republic of Congo in 2022, and then recently in Tanzania a couple months ago. The idea of the treatment network is that we're still working with partner hospitals, surgical teams, and community organizations, but we're also linking them together under the umbrella of the network. So that allows us to coordinate strategically about, where to bring women for care, so that, for example, a woman is identified by a community health volunteer who has fistula. That community health volunteer can refer her to the closest hospital to where she lives to make it easier for her to get to that care, but also, if needed, for her family to visit, for her to do any follow-up that's required at that facility, if there's any long-term care or checkups. So it just allows us to kind of have these really strong referral systems between the facilities in the network. The facilities can also support each other. So we recently had a case in DRC where one surgeon is wanting to learn more, or just develop his skills a little bit further to be able to handle more complex cases. And another surgeon at another facility in the network was able to link up with him and go visit and provide that mentorship and support.
Oh, wow.
So it develops this strong team of physicians that are able to learn from each other, share best practices, share solutions for treating the women in their communities, but also kind of strengthens all of the community outreach component as well. Yeah, that's some background on the treatment.
That's amazing. So you have like world-class kind of treatment plans, for each patient. That reminds me of World Telehealth Initiative, and they're able to outsource like specialty care through their telehealth. And that just, it reminds me of that. In terms of like the availability of obstetric care in these regions, like, was that a challenge, or were there good hospitals and physicians that you were able to source from there?
Yeah, I would say both. Are some incredible, talented surgeons who are working on this. I think one thing that's challenging is that it's not a lucrative field to pursue because many of the patients can't cover their own treatment.
Right.
And so, many talented surgeons might pursue a specialization in another field. But
or they will leave, right? Yeah,
exactly. So that's definitely a major challenge for us. So many of the surgeons that we support kind of have to show that they are already invested in caring for these types of patients before we start working with them, because we want to make sure that there is like a real motivation and history of doing this type of work. There are, we work with incredible surgeons. So we work probably with over 100 surgeons through our network right now. And so there are definitely many talented providers out there. There's still immense need, and the need is not always equal. So I think there are certain countries where there's more, we've been working for longer, or other organizations have been supporting for longer, so there's more capacity there, but there are other places where it's still a major challenge. So I know that FIGO is looking at this really strategically when they select their fellows for their training program. But of course, in addition to really well-trained surgeons, you also need the entire health provider team to be well-trained. So the surgical outcome is not just the result of the surgical procedure, but also of the post-operative care that the patient received in the ward. So you need really strong nursing teams and other doctors in the facility. We also support training not just for care of fistula patients, but also for general awareness of what fistula is and what care treatment is available for doctors, so that if a woman goes to a facility that doesn't provide fistula care, the doctor knows that they can refer her to a facility within our network where that care is available. So a lot of the awareness that we do is not just for patients themselves, but it's for community members and their health teams.
Hey there, I hope you're enjoying this episode. And if you are, would you do me a tiny favor? Show me some love by doing one or more of these three things. A, click the support this podcast link in the description to donate a few dollars toward the production of this podcast. My dream is to do this full time, and your support would mean the world. B, you can write me a review on Apple Podcasts And or rate me on Spotify to give me a boost in the algorithm. Or C, share this episode with someone who would love it just as much as you do. I truly and deeply appreciate you. Let's get back to the episode. Right, which then decreases the stigma in that community. Are there opportunities for, say, like OBGYNs or anybody who works in like obstetrics, like in the US or developed countries, to like come work with you guys? Do you guys do any like service trips?
We actually don't. Because we work through local partners, we generally let them take the lead. So there might be opportunities through our partners, but also we try to primarily focus on having local surgeons treat the patients in their communities and, for the sustainability of the project, but also because they know best how to serve the women in their communities. We want to make sure the surgeons can communicate with the patients and that the health teams can provide follow-up care and things like that. So we don't really have opportunities through Fistula Foundation for volunteering with our hospitals in the field.
I really love that, though. I mean, you're just focusing on empowering the communities themselves. That's amazing. Wow. So in terms of the amount of growth that has happened in the last year or so, how has that changed the trajectory of Fistula Foundation? What are you focusing on now?
Yeah. Well, you might have seen the really big news for us was that Mackenzie Scott gave us the largest donation in our history of $15 million earlier this year. Absolutely incredible, so generous, and just opens a lot of doors for us. So we've been growing rapidly. We were founded actually as a volunteer organization in 2000 to support the Addis Ababa Fistula Hospital in Ethiopia. And in 2009, we realized, there's so much need globally that we expanded our mission and we began supporting fistula care, not just in Ethiopia, but worldwide. And that started, I think, with just 5 facilities in 2009. And today we're supporting 77 partners, 70 of which are treatment partners and 7 of which are community outreach organizations. And within those 70 partners, there's actually almost 150 facilities because some of our partners work at more than one facility. We've also, since 2009, supported 80,000 surgeries since 2009 up to date. And now with this gift, we've put together a really ambitious, but I think achievable strategic plan. And our goal is that in the next 5 years, we'll treat another 80,000 patients. So we're looking at trying to do what was happened in the last 14 years in the next 5 years.
In the next 5?
Because we have, the partnerships and the relationships and we're growing, we think that we can support that. So it will require a lot of new partnership development. We'll continue to support our core strategies of not just, providing treatment, but also investing in training and outreach and infrastructure. But yeah, very, very excited about what's to come. And with that, we're also looking at expanding this treatment network strategy that I mentioned. So we just recently launched our 4th treatment network in Tanzania a couple months ago, and we're looking at launching one in 4 more countries in the next 4 years. So yeah, growing really rapidly. And I think those treatment networks are really incredible because we have local staff that help run those. And so one amazing thing is that staff is just completely dedicated to thinking about fistula in that country all day, every day. And so they're able to see, for example, just again, heard from our partner in DRC or our colleague in DRC that they had a stakeholder meeting with all of the partners in DRC, and they were able to look at a map of where the partners are currently working and where they're reaching women and able to see, where are there places where there might be opportunity where women are not currently getting care and what kind of work can we do together to reach those women. So it just allows you to not just be supporting a single hospital, which is doing really amazing work, but also it's an investment in actually drawing down this immense backlog of cases and making sure that women who previously never had access to care are now getting it. So I'm very excited about that.
My goodness. It's just like a growing, it's almost like exponential. That's
completely, it completely is. Because as you then, have these relationships and you get to know these really incredible surgeons, many of the new partners that we bring on are referred to us by organizations that we're working with. So yeah, it completely is exponential where we're seeing this tremendous growth.
You guys have a documentary that's out too.
Yes, Fistula that came out recently. Our team followed a woman in Kenya from the experience of living with fistula to getting treatment in our network and then returning back home. It's about 8 minutes long. I think it's up on our website if anyone wants to watch it.
Yes.
But yeah, just really cool to see kind of what that experience is like for her.
Yeah, I think that would be a really nice resource for anybody just to kind of learn and see, firsthand what life looks like with fistula, and then, what you guys are doing to like serve just one person. Because a lot of times when you think about, these big numbers of these number of people, right? Yes. It's hard to wrap your brain around like what's actually happening. So it's like when you're following one person, you're like, okay, this is actually what's happening times however many number of people.
Completely.
Right.
And that experience of getting that documentary filmed also it was incredible. The team that worked on that, we have a digital media manager in our office in the US named Morgan Walter, and she took the lead on making that documentary, but she also worked with our colleagues in Kenya and with a few other people to put that together. And I would hear stories from them about what it took to make that. And that reinforces the experience of what the women are living with. So for example, to get to the woman's home, they had to drive pretty far. And I think there was even a point where they had to like hike because there wasn't a road. And at one point there was a flash flood and the car got caught in the flash flood and they were rushing to get the camera equipment out of the car before it was washed away. Yeah. And just to then think about, okay, that was challenging to make that documentary, but of course it was challenging for her to get to a hospital in the time of labor. If that's the type of environment that she's living in.
I mean, is she walking there? Is she like...
Exactly.
And then a flash flood happens.
Pick her up, is that, and so exactly. It just reinforces like why there are these challenges that prevent women from accessing the medical care that they need.
Wow. Yeah. So please, if you're listening to this, go to the Fistula Foundation website, and I'll also throw a link in the show notes for you that goes directly to the documentary. It's only 8 minutes. Awesome. Okay. You have 8 minutes. Like,
absolutely.
Jessie, thank you so much for coming on. I just want to ask one more thing from you. How can people find you? How can people get in touch with you? And what can people do to support Fistula Foundation?
Absolutely. You can find us on our website, as you said, fistulafoundation.org. Also welcome to reach out to our team at info@fistulafoundation.org, and that'll get to the right person on our team to answer your inquiries. I will say one of the things that we haven't touched on yet in our conversation that I think is incredible is that on average, fistula surgery across our global network right now costs $616 from the time that a woman, that covers all of her care from the time she arrives at the facility to the time that she leaves. And so, that's not nothing, but that also relative to the cost of medical care in the US it's a fraction of what we would pay here.
Yep.
And that will cover the health provider costs. It will cover her food, the bed, the medical supplies, everything that she needs from when she arrives to when she leaves. And so I think, any amount of funds really, really support our cause. I think around 82% of donations go directly to programs. And so most of the funds that are given to us will go directly to making sure that women get the care that they need, supporting the local hospitals and local providers in delivering that care.
I just want to say, though, when you do donate, you're supporting the staff that is making this happen as well. Like, that's like not for nothing, because I think that there's a whole stigma around donations and like, oh, I want 100% of my donations to go to this cause. Well, who's running this cause? Like, come on.
There are some costs related to building those partnerships and to monitoring the work that's happening, making sure that that's being provided is quality care.
Right.
And so, yes, there are definitely some overhead costs. If there are ways to give without contributing to overhead, if that is something that you prefer, which you can find on our website. But again, most of the donations do go to programs and support just absolutely incredible providers. Like, the people we work with are true heroes. And sometimes this, because I work on the program team, I get to hear a lot of stories from our partners about what they're going through. And sometimes you just can't believe what people persevere through. So we have a partner, they're called Heal Africa. They're based in Goma and Democratic Republic of Congo. And I got an email once from them that was like, we're so sorry that our grant report is late. In addition to the COVID pandemic, there was an Ebola outbreak and a volcano eruption, and we had to evacuate the hospital and provide care to people in the community, and this, and you're like, of course it's okay that this is delayed. How are you delivering care in these circumstances? And just many of our in some areas where there's political instability, they're still going in there and they're, at risk to themselves to make sure that women in these difficult areas are getting the quality medical care that they need. And so, the people we work with are just incredible heroes. And I feel very fortunate to get to be part of this organization and part of this mission. Yeah. So we also like to share a lot of their stories through our emails and through our newsletter. You can find those on our website. And you can also sign up for our emails on our website if you want to learn more about some of those stories. But we have an amazing network. I feel very fortunate.
Wow. All right. Well, if you're listening in, please go to their website, learn more. And thank you so much for coming on. This was so good.
Yeah, thank you so much for your time and for inviting me to participate in this.
Of course. We'll talk soon. Thank you for listening to this episode. If you'd like to learn more about today's topic and guest, head over to the show notes linked in the description of this episode. There, you can get access to resources, links, and ways you can get involved in the pursuit for global health. And if you loved this episode, don't forget to write me a review on Apple Podcasts and rate the podcast on Spotify. It helps me get in front of more people just like you and continues to elevate the causes we are so passionate about. I'll see you in the next one.